Dr. Hamid Jafari is the Director of Polio Eradication for the World Health Organization's Eastern Mediterranean region. Doctor, thank you so much for joining us. The campaign's in its third day. It seems good progress is being made because you're ahead of schedule. But talk to us about the progress and also the challenges of this campaign.
So the most important element for the progress is that all parties have adhered to the commitment of the humanitarian pause in the middle area. That's the first campaign phase, as you described it. And that has given the confidence to health workers and, most importantly, families to bring their children for vaccination. And so, as you mentioned, we have exceeded the target that was estimated of children under 10 years of age in this area of 156,000, because in the first 2 days, 161,000 children have been vaccinated, and we are waiting for the counts for today. Now, the challenges, of course, are that we think that there are maybe more children than we thought are in this area. Maybe more children have moved into this area because of what's happening overall across, particularly southern Gaza. So we are having to change our tactic a little bit so that in addition to the fixed vaccination sites, we're increasing the number of mobile teams that can go into shelters, into neighborhoods, into communities to look for any children that actually did not come to the health facilities for vaccination. So that's the challenge now. As happens towards the latter stages of a vaccination campaign, it's the search for unvaccinated children. So we have an agreement with the Israeli authorities that if we estimate that there are still more unvaccinated children, that the campaign will continue tomorrow as well for the fourth day in areas where it is needed. And then ultimately there is going to be a post-campaign assessment to see what is the kind of coverage we've achieved to assess whether the proportion of children that may still need vaccination in this middle area.
Yeah, and I would imagine, you have these 9-hour chunks to administer these vaccinations, and then you have to do it all again, I think, in 4 weeks' time, because it's a 2-dose vaccination, all within essentially a war zone, albeit with these pause areas. Talk to me about the coordination that this requires and whether you still feel confident you will ultimately be able to finish this campaign successfully.
So we are still early in this phased campaign. We're just sort of towards the latter half of the first of these 3 phases. And then, as you said, we have a second round. So it has taken extensive coordination. But I think what has made coordination easy are 2 or 3 very important factors. One is that WHO and UNICEF and UNRWA, these 3 main UN agencies, are working very closely with each other, but particularly with the Ministry of Health of occupied Palestine territories. And they have established an emergency operations center and technical committees that are looking at the situation on the ground and adjusting operations. I think what the second factor is that in polio vaccination campaigns, the micro-planning, which is the local level planning that is done based on the distribution and size of communities and population where the children are, looking at health facilities, temporary vaccination sites, and plans for outreach vaccination that plans the number of health workers, the number of vaccines to be distributed, cold chain and such. That is very clearly defined by space and by time. And that plan then makes it easier to coordinate with the parties that are responsible for providing the humanitarian pause, the fighting parties, so that everybody knows when and where the vaccination will be taking place. So that has facilitated coordination, but it took several rounds of discussions and coordination to get to a place where these humanitarian pauses could be agreed upon. And we are hoping that everybody stays with their commitment to these humanitarian pauses.
Absolutely.
And ultimately, of course, we want peace to prevail because there are many big problems around health and humanitarian needs of this population in Gaza.
Thank you so much for that update. Much appreciated, Dr. Hamid Jafari, Director of Polio Eradication for the World Health Organization's Eastern Mediterranean region.